Welcome to the Movement PT Coffee Cast, where we sit down and talk about physical therapy, health, and whatever else comes to mind during our coffee-infused conversations. All right, guys, welcome back to the Movement PT Coffee Cast. My name's Dalton, and with me, as always, is my beautifully bearded friend, William. William, how are we doing today?
Doing really good, man. Can't complain. How about you?
I'm not bad. I'm not bad. You know, it's 8 p.m. and we're drinking coffee again, so we're back. We're back at it. You know, it's like same thing, different day.
I'm super happy because not only are you drinking coffee, but you also have the coffee hat on.
And the Minion mug. So we're back at it again today, guys. We have a quadcast today. We have two guests on our show. We have a physiotherapy student, Taylor, and we have a physiotherapist, Teddy, on the podcast with us today. What's going on, guys?
I've always wanted to be a physiotherapist. I feel like that sounds so much more professional than physical therapist.
That's a Canadian thing, maybe. I don't know.
Is it?
It's definitely something I aspire to be.
Definitely sounds cooler.
Oh, I agree. Sometimes I flip-flop. I think in our bio we have physical therapy students, but I don't know. It is what it is.
So let's just kick it off a little bit by giving a little intro. If our listeners don't know who you are. So Taylor, you want to start off and just let everyone know who you are, what school you go to?
Yeah, so I'm about to be a second-year student at George Fox University, which is just outside of Portland, Oregon. And before PT school, I took about 4 years after undergrad where I was working as an aide in a lot of different clinics. I also became a personal trainer during that time and started doing some training on the side, and then also went back and got a post-bac in exercise science. My first degree was a liberal arts degree. But I always knew I wanted to be a PT. And that brings me to now. I'm back in Oregon after spending a month with Teddy at Healthy Baller, which was awesome. And here we are today.
Great. And Teddy?
Yeah, so I have kind of a similar background to Taylor in that I took 4 years off between my undergrad and graduate degrees.
Wow.
And I spent that time I was lucky in that I wasn't a PTA, so I didn't have to witness like 4 years of external rotations with bands and sit-to stands. But instead, I spent my time being a personal trainer, group exercise instructor, and strength and conditioning coach at the high school level and a little bit in college too. And so, you know, when I went back to physical therapy school, that kind of was like this basis for me to learn everything through. Or a lens rather for me to learn everything through. And so the whole time I thought to myself, how can we apply these concepts to strength and conditioning and vice versa, and how can it all kind of blend? And so that's really what's brought me to my practice and what I do now. I work in a sports performance facility. I opened up a physical therapy or physiotherapy practice inside this facility almost 2 years ago. It'll be 2 years ago in August. And you know, what we try to do is provide sports medicine focused care to athletes and active adults.
Nice. That sounds awesome. I mean, obviously we've seen your content on Instagram like crazy, and it looks like an awesome environment to work at. And that's kind of why we have you guys on. I think it's an interesting dynamic in a couple ways. The fact that like, obviously, Taylor, you were just at Teddy's clinic as a student, and then the environment that you guys have there at Healthy Baller, I think is unique. Would you say that in terms of the way that you guys approach treatment, at least from what we've seen as students over here in Canada? Like, not a lot of physiotherapy clinics go about treating it that way. So I think it's an interesting conversation we can have here. So how did you guys kind of get hooked up? Like, how does it work for you, Taylor, to like do a placement? Because you're not in school near Teddy, are you?
Yeah, so I'm actually from Maryland, which was my bargaining chip with my, we call him DCE, the Director of Clinical Education. But I had looked up places on Clinical Athlete that they have a directory of PTs and chiros and other rehab professionals who have a more evidence-based strength and conditioning bias. And Teddy and then one other clinic at the time were the only two listed in Maryland. And the other clinic was about half the distance from my parents as Baller. And I did all this before I even started PT school. I had a little spreadsheet going and stuff because I had talked to some second and third years who told me that we were able to have input as to our rotations. And just over that year or so, I followed Teddy on Instagram. I actually found him on Clinical Athlete, not Instagram. And I followed the other clinic and clinician, and I liked his content a lot better. So I requested a rotation with him instead of the other place.
Let's see, there you go. It's all about Instagram. It's all about the content you put on Instagram.
But I will say I did not request my rotation through Instagram. Okay. I just pulled his contact off of Clinical Athlete and I gave it to my DC. And it took a little bit of convincing because he was like, oh no, like that. First he's like, you'll never get that, blah, blah, blah. He was very negative. I think he's having a bad day or something. And then some third years were really encouraging and they're like, just follow up with him, like send him an email. And he was like, you'll never get that. You won't even get it your third year, but like I wouldn't even ask for it for you until your third year. And they're like, no, just email him and be like, Dr. So-and-so, it was great to chat with you today. Here's what we talked about. And then you outline what you want, not what he said. And so I did that. And like 2 months later, I got an email from him and he forwarded Teddy's response. So,
nice.
That's awesome.
Yeah.
So like if you were to give some advice to students kind of looking for a clinical placement, you know, like what would be a couple things that you would say to them?
Yeah, I think a lot of students come into PT school not knowing what they want to do, which is fine, in which case you probably want to get a good breadth of experience. But even within that, I think you want to make sure you get good experiences. So like, I don't want to end up in a SNF long term, but I asked around and the guy I'll have as a CI for my SNF this coming academic year has a really good reputation as being really engaging, really evidence-based. So I'm like, okay, that's somebody I can learn from. So even if you don't know what you want to specialize in, go ask people who are a year or two ahead of you in your program, like, hey, for this rotation, who do you recommend? Who have you heard is really good? Or if there are places where you did observation hours that you're like, oh, this is really intriguing, that's always an option. And if you do know what you want to do, obviously you want to pursue that. If you're interested in the cash base, I think I'm really glad I did it at the beginning of my clinical placements, because for us that means it's a shorter rotation, simply because part of what makes cash base so awesome is that the patient volume is pretty low. But as a student, that also means you just get less overall reps. And it also means you get more time to discuss things with your CI. So I think it's a really good fit for an early rotation. If you can find that. I wouldn't want to do it as a third year because I wouldn't have like a full-time caseload, especially if I'm going to be working in a traditional setting right off the bat, which, you know, who knows.
Right. So later on to get more reps kind of with patients, like that's kind of what you're saying?
Yeah.
Okay, I see what you're saying.
Yeah, that's a good point.
Yeah, it's still like tailor, you know, your rotation request to your interests, or like try and find CIs who will be good mentors, but maybe in an environment where you can get more exposure.
Okay.
That makes sense. Yeah. Teddy, how long have you been taking students on for? Is this something new or?
Yeah, it's something new. I've been in practice for 3 years, and Taylor was actually my first student. I have another student right now, and he's the exact opposite. It's actually his last rotation, and he's graduating this fall. So, you know, I think what Taylor said about the cash-based thing is true in respect, or with respect for the fact that you're just not going to get the same amount of reps. I mean, especially with the way that my cash base is set up, these people are coming to see me, and so I can't just pass them to a student. It's just not, just realistically the way business works, you know. So that's like one of the challenges. And at the same respect, you might get more like a deeper dive into any one patient and more conversation about that case and that sort of thing. So there's really two sides to it. But I think it's a better rotation like at least for my rotation or for my clinical experience, I think it's better for somebody that's earlier in PT school, but has a background in the field.
Yeah, so they can kind of jump in and have input and like contribute, right. Especially being that cash-based model where, like you're saying, you can't just kind of pass it off to a student, especially if they don't have any experience.
Yeah. Yeah, and like, you know, for me, Taylor can attest to this, probably half of my patients, we ended up either like squatting, deadlifting, or like running or doing like, you know, very active things with. You need to kind of know how to do that stuff and coach that stuff outside of your physical therapy school education, because as we all know, you're not taught that in PT school.
Right.
So it's almost like expected that you just go learn on your own. You know, there's not like a ton of job paths where you have to know so much outside of school in order to really be successful. Physical therapy is one of them. And so, you know, when you start talking about the cash PT and the more active population, like, you really need to supplement your knowledge outside of it.
Right. So what would be kind of like what would you hope that a student would get out of a placement with you?
I would hope that a student would understand that I would hope that they would see a different approach to physical therapy. I would hope and by different, what I mean is a little more movement based, and also I put a huge emphasis on like how I speak to my patients, right, and the words that I use. And, you know, I think this stuff is kind of popular on the internet and within our own little echo chambers, but the reality is that in the field as a whole, it's not popular at all. None of my CIs talk to me about like how we frame pain and how we like contextualize things, but I talk to Taylor about that stuff all the time. So, I mean, to give you a succinct answer, I would hope that a student would leave my clinic with an understanding that there's more to PT than maybe what they've seen in their other experiences, and that the language and like your interactions and that sort of thing are honestly just as important sometimes as the exercises that you choose to do with your patients.
Yeah, I agree with you saying, because just what I've gotten from following you on Instagram and seeing your content is it does show you a different side of what physical therapists can do. And I think that's honestly something that's motivated me to go down that avenue, because I've been in the clinical setting, like the 9 to 5, like the typical mill clinic. And I just don't feel like that's something I want to do for my whole career. So honestly, when I saw that there's other options, like what you're doing maybe, and kind of like what Zach's doing at PT Wellness there in Boston, like there's a lot of different avenues we can go as physical therapists that isn't necessarily traditional. So it's cool to see that there's, you know, that there are CIs out there that are taking on students and showing them that route.
Yeah. Yeah, and like what Zach's doing at Boston PT and Wellness, they have a more traditional clinic. They have brown carpets and brown tables and low ceilings, and they're on the second. I mean, I've been to that clinic. I went there and hung out with Zach for a day. They're on the second floor of an office building. Like, it doesn't look like my clinic, but their approach is the exact same.
Yeah.
And you can and Taylor will tell you, I also see, they're not on Instagram, but I also see general population patients, and I get those people that come to me via word of mouth, typically, or they find me on the internet, and they're convinced that it's the place for them to go, even though they have no interest in the squat rack. I think that I can also help those people more too, just because of the way that I'm framing things and
right,
and the different approach. And so, you know, it doesn't have to be that you're some hardcore sports performance person and like all that. It's just, I think it's just like really caring about the actual, like the entire experience for the patient. And that's, I'd love to see it taught more in school so that there didn't have to be this like small select group of people online that really cared about it.
Mm-hmm. And I think you kind of touched on it, that's something that can be implemented into other clinics, even if they don't have the facility that you have. So I think that's kind of like
towards the end of my time there, we saw a kid who had come from a different, like, more traditional PT clinic, and he's like, yeah, they told me they outgrew their space. His single lane balance was terrible. And Teddy said to me, he's like, you can do a lot with this kid in a very little bit of space. Like, he should be further along than this, not because he should have been squatting, copious amounts of weight or anything like that, but just because they didn't even use what they did have. And maybe that was an issue of a knowledge gap, of the clinician who was treating him or whatever. But yeah, like, there's a lot that can be done even in a small space with limited equipment.
The other aspect for a kid like that too is if he's coming from an insurance practice where he's spending 20 to 30 minutes at the most with his therapist and the rest of the time with the tech, when this kid is a 3-sport high school athlete coming off a knee surgery, like the tech's not going to be able to progress him into what he needs to do. Right. And so that's the other challenge. Whereas like at Boston PT Sports and Wellness, they have a culture that they've created where the techs can help with that stuff because they've learned that over time. Or in my scenario, I don't have techs because I see people for an hour. That makes me cost prohibitive to some people, which I'd rather not be. I'd rather have everybody be able to afford to see me, but it's just the reality of it. So it just takes an entire clinic and culture to really to try to serve these other populations.
Yeah, that's interesting.
Yeah, Taylor, I'm curious to hear, like, how did your classmates respond to, like, you going and doing a placement with Teddy and just that environment? Did you have any questions from them about how it went?
Yeah, so there are a couple guys that follow Teddy on Instagram, and they were really excited about that. I had one girl ask me why I even bothered going to PT school since I was so interested in strength and conditioning. I should have just stuck to that.
Oh.
My first boss said that to me.
Yeah. And then there are 2 other girls in my class one was a college athlete and the other one was an ATC in college. And they were both pretty pumped. And like, we would chat on the phone pretty much every week or like text back and forth. And they were both stuck. The one girl was in a pretty, dare I say, typical clinic where she did a lot of modalities, and at one point she's like, why are we doing joint mobs on every single patient?
Yeah.
And the other one was in a setting where she saw a very non-athletic population, but her PTs were very tuned in to pain science and patient education. So that was really neat just to kind of see some overlap, even if we were seeing different demographics, and then also see the contrast of, it didn't matter who the patient was, they all got the same approach.
This is good though, because when I asked Teddy like what he was hoping to get out of his students, one of the things that he was talking about was education. And like from talking to you like before, like that's one thing you have some comments about that, kind of some things maybe you've learned about educating patients.
Yeah, I think one of the biggest takeaways for me was realizing that sometimes education is not saying anything. And Teddy was telling me that one of his professors gave a lecture about therapeutic silence. And that concept has really stood out to me because I think in PT school, especially in a program like mine that's very progressive and talks a lot about patient education and pain science and cognitive functional therapy and all this stuff, patients start saying ridiculous things and you're like, oh, like I get to inform them, I get to correct them, and it can be really exciting as a first-year student to be like, oh, I'm going to go change their life with education. Well, like, if you come firing on all cylinders, A, they're probably not going to, like, take it all in. B, they're probably not going to come back to you because they'll think you're a jackass who doesn't know anything. As soon as they've had 5 other people tell them X, Y, and Z. So that was really helpful for me to just see that model and kind of be like, man, there's so much, like, I'd be watching the eval and be thinking, oh, I want to say this, I want to say that. And Teddy wouldn't say anything. I'd be like, the first like 2 evals, I was like, what on earth? And then I very quickly realized that he would start to present his plan of care for them. And you would see the wheels start turning in their head and them start connecting the dots. And that was a lot more powerful and them drawing their own conclusions. Some people would be like, well, yeah, like what about this when, my PT had to put my sacrum back in? And, he would just kind of like, not deflect it, but like answer it very casually. But that's a lot easier if the patient raises that question than, you know, the PT coming in, oh no, your sacrum wants out of place. Like, never mind that pain that is very real that you feel like.
That's true. That's
Yeah.
a good point. That's a really good point. Teddy, do you like what are some of the things that you try to do as an instructor to foster that like learning for your students in terms of educating? Because it's such a huge piece, and I think it's something that we need to learn more of in school, and we don't really get a whole lot of it. And even on clinical placement, from my experience, it's not focused on a whole lot. So I'm just curious to hear what are some strategies that you use to do that.
In terms of patient education?
Yeah, like how you went about like teaching Taylor or kind of showing her how to do those type of things, because it can be difficult.
Well, I mean, a big part of being a CI in that experience is that you're teaching through observation. I mean, you know, the student experience starts with just watching you kind of do your thing for a week or two, and then they start to pick up where you left off. And what I do is like try to file away little things. And sometimes I would like look over at Taylor and we'd like kind of recognize like, oh, we're going to talk about this later, you know, or we try to not laugh at our patients. But for me, it's all about like telling her what I'm thinking and why I made those decisions, and just filing away these experiences with the patients as, okay, this is a teaching point for later, you know. And so like the education for me is such a big thing, because no matter how much you talk about it in textbooks, there's nothing that can prepare you for patient education. That's just a completely different animal. And I actually had an eval today that she told me that her T9 was slipping out, and her atlas, she went to a chiropractor. She said, my atlas and my axis are good this time, but my T9's out.
Oh my God.
I was like, well, I'm glad that your atlas and your axis are good this time. You know, but last time those were the ones that were out. And then she went to a DO that told her something different. And the way, once she got through her like 10-minute spiel and I kind of let her talk, I said to her, you know, do you ever find that this information is confusing when you hear these different stories from different providers? And she said, yes. And like, that was all I needed. You know, I didn't need to tell her, hey, this person's wrong. This person's a jackass. They're making this stuff up. None of this is substantiated through research. And I just said, and so I try to find like a way to relate to a patient, and, you know, and then I try to show the students, like, that's your number one thing. In order to get a patient on your side and like with you for the care, you just have to show them that like you can relate to them. And so oftentimes when you try to combat what they're saying with factual information, they don't take it, they take it as combative. And so, you know, those are like big teaching points for me as a CI. And I'm very conscious of the fact that I have a different kind of practice in clinic. And so I want to give students an experience that they can take beyond just healthy baller, because, you know, Taylor saw a number of professional athletes. A lot of physical therapists go their whole careers without seeing a professional athlete. Excuse me. So I don't need that to be the focus of like this, you know, you need to know how to work with this 6'10" person with long femurs. Like, I want more kind of generalized, this is the way we communicate with people. This is the way we approach things. And that's, you know, that's really my focus.
Yeah. Go ahead, Taylor.
I think one other thing that was super helpful is realizing, and I kind of already knew this going in, but it was neat to see it in action. Like, the fundamentals are the same for everybody. So we had one patient who was a high-level lacrosse player, and he had a hamstring strain and it kind of spiraled. And we were doing different exercises with him, and Teddy's like, well, if you want to target it a little bit more proximally, have him, you know, position him this way and change his torso angle, etc. And then he's like, how do you feel the difference in the muscle contraction? And then just kind of like talking about it while the kid was doing his set, like, that perspective was not like, oh, this is some special way we think about athletes. It's, no, right. This is the way your femur is, and this is where your hamstring attaches to your femur. And this is how your femur is related to your pelvis, which is related to your trunk angle. Like, it's very, very foundational concepts that I think in school are really easy to gloss over because they're not exciting and they're not sexy and they're not marketable. But if you nail that and use that to inform everything you do, it doesn't matter what setting you're in.
Right. And then coupling that with those communication strategies and that educational type stuff.
Well, one interesting thing, so the athlete that Taylor was talking about, he's also one of those people that he'll come in and you'll ask him how he feels and he goes, it's not getting better, you know? And so like you're from that point, that initial communication, you're almost like, we would joke around, but like you're pain sciencing him, you know, you're having that conversation of like showing him that it is getting better and making sure that like they're confident in like, because once somebody thinks it's not getting better, they're not doing their home exercise. They're not bought in anymore. You know, people are only bought in if they think that there's progress being made. And so like you have to, and then they start losing confidence. And especially with a young athlete that's never really been pulled off the field, you know, I think that the communication with them is just as important as the person that's been noceboed by like 3 different chiropractors about how their bones are slipping all over the place. So, and that's another kind of like general application that it's not, you know, you need to pay attention to your words with more than just chronic pain patients, like with everybody. And you never know how many patients you can prevent from getting into that chronic cycle through your education as well. So.
Yeah. I'm curious, Taylor, did your experience with Teddy change the things that you post on social media, or even like the way that you are structuring your posts and stuff like that?
Not a ton. I think it was helpful.
Uh-oh.
Thing.
Taylor,
and
you
I
gotta
think
go
as
back inside.
Dang it. I was inspired.
I know.
Here, I'm going to turn off. Hang on.
We'll get there.
Okay, am I here?
I mean,
Can you guys hear me fine?
Yeah, you're good.
All right. Sweet. I just turned off my Wi-Fi. I want to sit in the grass. I was inspired by Teddy. No, anyway, I think being a healthy baller, I got just a lot more footage than I had previously, which was good to kind of kickstart me posting more frequently. But I think I already structured my posts fairly similarly, not necessarily on purpose, but just because that's the way that made sense to me. Although I definitely stole the emoji usage from Teddy. And I think other people are starting to pick up on that. I got tagged in something recently. Like, is this how you in strength coach therapy do it? Yeah, but beyond that, and I definitely started doing some split screen stuff more, just because I realized like it does help with engagement. And then just a tip Teddy gave me, I guess somebody else had told him that using that feature where you can put multiple videos or multiple images in one post, that definitely makes a big difference. I get way more engagement when I do that. So that's something I changed.
Nice.
Yeah.
Teddy, I'm curious to hear, like, did you ever expect the Instagram thing to get to where it's at?
Oh man, no, not at all. Not at all. It was like completely accidental.
Yeah.
I mean, I had a blog going for a couple years, and I've always been really into like self-education, but I literally didn't like try to get online and tell people how to do things until I was in this field for almost 10 years. And then when I started doing it, like, it was honestly just for a networking tool because I wanted to get to know other people that had the same passion that I have. And I knew that there were like these groups of like people that were super passionate about this stuff and getting together at conferences. And like, I just wanted to kind of be a part of that. And, you know, because there's just not that many of us, like, I don't really know many people in this area. And the few people I do know in this area, including Wesley, who I hired last October, the few people I know in this area that really care about this stuff, I met them through the internet. Like, it's not like I met them because they were my coworkers, you know? I mean, I started my whole thing just to network and connect with other people. And it was like right time, right place, offering some novel information, being really consistent with it. And next thing you know, it's like crazy followership. It was really kind of insane.
Yeah, me and Will talk about that too. It's just crazy to think, like, even just we use it the same way. Like the connection we've made through Instagram is crazy. Like the networking tool. It's just people. I don't think people realize how powerful it can be in connecting people across the profession. And I think if more people realize it, that you would probably see more people putting out content or even just using it as a tool to connect.
I've met so many wonderful, like hundreds of just like awesome people. I've met people that I will probably know in some capacity, like for the rest of my life through Instagram. I mean, you know, so it's crazy. And that was the goal. And it's not like you need 300,000 followers to do that. All you just need is like to just kind of like the way I started was I just reached out to other people that I respected their content. Like Mike Reinold, for example, you know, physical therapist in Boston. Like I reached out to him and I was like, hey man, like I've been reading your stuff for years. You know, I just wanted to say hi. And like, he didn't follow me right away, but he was just like, hey, I like your stuff. Like, keep it up. And then like a few months later, he starts following me. And then like 6 months later, he reposts me and like, you know, but it's like, I just reached out to a lot of these different people and yeah, man, it's a connection. It's incredible. Yeah. And I've learned so much through it too.
Yeah. The learning, the ability to learn off of it is actually, it's interesting. I don't think a lot of people see it as a learning tool, but like, you can see a post and then that can lead you down the whole of like a podcast. It can lead you to research that can lead you to like many different avenues of an area that you might not really know much about.
The other day I saw a repost on Tom Walters' page, Rehab Science. And then it was a repost from somebody else. And then I went to their page and they had the article linked. And then I, you know, since you can't copy and paste, well, they didn't have it linked, but they just had the article typed. I went and typed in the article into PubMed. And like, next thing you know, I'm like reading an article that was from a freaking like somebody like reposted, you know, and it's like, yeah, you're right, man. You go down these rabbit holes. And better to go down an educational rabbit hole than like some person you knew from high school.
It's true. Very true.
So true. Sometimes I've even like, if you go on people that are like, you know, smarter than you, and you just look at their comments, and you see some people like debating over a topic. And you're like, I wonder what people are saying about this. And it just like gives you some perspective, even if you're not like directly engaging in the debate or whatever. It's nice to kind of like get some new perspective or some ways that people think about things. I kind of think.
Absolutely. That's what Facebook's really good for.
Yeah.
Like, I don't know how people do it. I guess the time that I put in is for my own content, but I see people that like so regularly, like on like Jared Hall's page, for example, like people will just be like debating on there. Yeah. And I'm just like, man, I don't have time to it. The one problem with that is like, it's kind of fruitless. Like once you debate with somebody, you come up with this really well typed out response and then it just disappears.
Yeah.
So,
yeah,
you know, whereas if you put that time into like a blog post or something, like even like a 500-word post, it can last a little more.
It's true.
Yeah. Or even an actual Instagram post.
Yeah.
Right.
Mm-hmm. The thing too is I just started listening to the You Are Not So Smart podcast. It was recommended to me by Derek Miles. And he suggested I start with the backfire effect episodes. I think so I'm on the first one. But basically it's the concept that whenever somebody has a really strongly held belief, even if you present factual evidence to the contrary of their belief, instead of that changing their mind, it actually will solidify their contrary opinion. So that's been really interesting and thought-provoking, and I think is very applicable not just to patient education, like we were talking earlier, but also internet comment wars.
True. Yeah. All right, guys, so it's about that time in the PT Coffee Cast where we ask our guests how they brew it. So we'll start off with Taylor. Taylor, we're curious to know how you brew your coffee.
I am not too much of a coffee snob. I usually buy the cheapest Trader Joe's brand stuff that they have, and then I make it pour over.
Nice. That's okay.
Because I actually don't know how to make coffee in a coffee maker.
Like a
what?
Okay.
And I'm not a huge fan of Keurig. So I like my classmates laugh at me because I've got like the little plastic pour over thingy, and I keep my coffee at school and my little filters. Nice. And we have a hot water faucet and I have my little pitcher thing, but I don't measure it. I just like eyeball it and go.
Yeah, that's okay. That's
and all the people who are baristas like have mini heart attacks.
Hey, we're not claiming to be baristas here.
No, definitely not. No,
well, like Portland has such a snooty coffee scene, so there's multiple people have expressed horror that I do not weigh my grounds and my water or time it. Oh, look at Wilbur.
And as Teddy is looking deeply into his dog's eyes.
That's what I do. I come home.
How do you brew your coffee?
And we just stare at each other. So I have the Keurig pour over method and then the real pour over method. The Keurig pour over method is those little like eco brew cups that you put the fresh grounds in yourself.
Yeah.
Okay.
Yeah. So like morning before work when I'm just getting out of the house, I put the grounds in the little pod, and then I just throw it through the Keurig. So it's like still fresh coffee. Like I don't use the little plastic like pre-filled things because those sit on the shelf forever. But it's pretty good. I use Pete's coffee, and then on the weekends I'll do pour over myself too.
Oh yeah.
I started doing pour over camping actually, and I got into it then, and then it's delicious.
There's nothing better than
Really good.
Saturday morning just doing a nice pour over cup.
Oh yeah, man.
It all in. Woo.
Yeah.
The best for that is we use the AeroPress.
Nice.
And you can take that anywhere, and it's like indestructible.
That's sick.
Yeah, so I take it always. Like I actually took it literally all across Canada. I did like a whole Canada trip, and my AeroPress survived the entire time.
Nice.
Yeah.
I did a cross country trip with my wife, and it was actually where we got engaged. We were boyfriend girlfriend at the time, and we realized that one pour over wasn't enough when we were trying to kind of get things moving. So I actually used like just a funnel that you would use to pour like oil into your car. So I just have like a cheap plastic funnel and then a coffee filter, and that's all you need, man.
That's epic. That's the best story we've heard so far.
You guys are so resourceful. That's hilarious. All right. We'll move on. We just have a couple more questions. One of them is like just something obviously with the setting that you guys are in or that you were in for placement and that you work in. We know you've kind of talked about how PT shouldn't be risk averse when it comes to prescribing exercise. So our question is, why is that something that you talk about? And why do you think it is that we're often kind of underloading and under challenging our patients?
Because we're scared.
So what would you say to some people who might be a little bit scared of maybe loading their patients a little bit heavier?
I think that the load creates confidence, and Zach Gabor jokes around about psychological reps, but I think that's an important part of it. So I'll tell you, instead of giving you like my total explanation, I'll give you a little anecdote. So Taylor and I had a patient who flies a lot for work, and the number one thing that he stated as his problem with his back pain was picking up his luggage. So on his second visit, when he was feeling better, what did he do? Single arm farmer's carries and deadlifts with a 10-pound kettlebell. Right. So like, it's not like it was heavy at all, but like we loaded him, and he's a guy in his 60s and he didn't want to lift weights. He doesn't lift weights at all. But like, I felt like that was the number one priority for me, was reintroducing load. And for that guy, I haven't heard back from him. So that's a good thing. That was pretty much all he needed. And I'm not saying that the kettlebells fixed him. We did a lot of other stuff too, but reintroducing it that quickly and having that look on his face, and he was like, wait, you want me to do that? And I was like, yeah. And like, we started with the kettlebell on a 12-inch box. Nice. And so like, it's not like it was like down from the ground even. It was like a super simple thing, but he was surprised that I wanted him to do that. And he had gone to physical therapy for multiple treatment sessions before, and he didn't do anything of the like. And so for me, it's creating confidence in the psychological reps so that the patients know that they can go do something, and so that they can go do something, And so I'm not loading people. Like I'm not turning geriatric patients into powerlifters, but I'm, what's more functional than sitting and standing and picking up things from the ground, and that's squatting and deadlifting. So That's my 2 cents on it.
Taylor, do you have any comments on that? I know we talked a little bit about that before on Instagram.
Yeah, I think Teddy pretty much covered it. I would say too, something that's been really helpful in introducing like that concept with classmates just in conversation is at the beginning of the year, our professors told us in an inpatient like care skills class, they made up this little acronym called AMAP, which means as much as possible, as normal as possible. And it was in regards to like trying to get the patient to help you with transfers and that sort of thing. But I found that's a really good reference point when we're talking about therapeutic exercise. That if somebody's like you and I'm like, oh, I'd want them to do this, and they're like, oh, and I'm like, hey, remember AMAP, and they're like, oh, and like just being able to take that concept from something that was about, you know, transfers and inpatient and very not strength coachy to, you know, like, oh, I do want this person to squat right away or on visit 2 or whatever the case may be. There's a little bit more context of like the bigger picture.
Yeah, that's cool.
And I want to add one thing too, just from a physiological standpoint. If you look at every single tendon-based injury and the research behind it, they respond much better to load than they do to like stretching them. Most tendons, they don't want to be stretched under load. That's what causes the pain, whether it's a deep squat in your patellar tendon or your rotator cuff and reaching across your body. And so you need to load them in a shortened position. And that's just straight research, man. That's just evidence-based physiological adaptation. And so when we start really like overemphasizing mobility and stretching, because that's kind of like the paradigm that a lot of our older patients are familiar with, like, oh, I just need to stretch more, you know, that's a problem. And so the load, even for rotator cuffs and knees and all that stuff, it has a analgesic and you know, healing effect. So that's a totally different kind of load than the squat deadlift, but I think both are extremely important.
Yeah, I think that becomes the problem is when it's the pain thing, right? Like, at least what I've seen is like, oh, if it's causing the pain, then we can't do that. We can't do something like that's causing the pain. I think that's that just not understanding that how pain works, and that it doesn't necessarily mean, you know, that there's damage because they're experiencing some pain or some sensitivity when you're loading them with those implements. So I think that's something that I've seen anyway, that kind of deters maybe physical therapists from actually loading patients.
Yeah, and if it's causing pain, like, you're not going to like move up in weight and intensity and make it more challenging, but you're like, look, if this doesn't feel better as you continue to hold this, I mean, if it causes pain, back it off to isometrics, but still keep loading it. And if that's still causing pain, then maybe at that point you add in or you decrease the weight via, you know, some other mechanism, whether it's a TRX in their hands for their knees or, you know, whatever it is. But I think explaining to them about the pain, and you don't have to, this goes back to the conversation about like education. You don't have to give them the whole like physiological, like tissue damage and pain. And like, you just have to tell them like, look, a little bit of pain is okay. And that's normal, but I want it to improve over time. And if they understand that and they hear the words okay and normal, sometimes that can kind of dampen the alarm.
Cool.
Mm-hmm.
I think that's huge. Like that idea of like, okay, this is going to improve over time. Because something I've noticed is like a lot of the hesitancy comes from like situations like, say someone has back pain when they bend over. They're like, oh, okay, well then we can't bend over. When in actuality, like loading them in some way in that same kind of movement is going to be kind of how you're going to progressively load them. You know what I mean? Rather than just eliminating it totally. I've kind of noticed that like with some physiotherapists. Yeah.
Habituation, adaptation, desensitization, whatever you want to kind of label it as. And now there's certainly an expertise to that, and you don't want to just haphazardly load people. And there are times where almost anything will flare them up, and that's what you learn with experience. You know, so you don't want to just like say everybody needs load, but yeah, we could like swing the pendulum a little bit more towards loading, and it would still be safe in my opinion for most people.
Cool. So to wrap it up, guys, we like to ask our guest one final question. So we'll start off with Taylor. So Taylor, if you could offer one piece of advice to another physical therapy student out there, or maybe someone that's looking to get into physical therapy school, what piece of advice would you offer them?
Oh, that's a tough one. One piece of advice. I think keep an open mind but also stay true to the foundational principles. And that is sort of, I think, where integrity is found, when you're humble and willing to learn, but you also aren't going to compromise on the stuff that really matters.
Awesome. That's amazing. And Teddy, for you, if you could go back, and offer yourself one piece of advice before you kind of got into the physiotherapy game, what would you offer yourself?
Is this in terms of like advice for somebody that is applying to PT school, or like what stage?
I think more just like you're just about to start your career, because like we're just about to get out there and get after it, right? So trying to kind of get an idea of like a piece of advice that you would offer yourself, like if you were looking back at that time, knowing what you know now.
Yeah, I mean, I know this is kind of cliche, but I would say like just don't stop learning. I think that a lot of us in the internet world are very outpatient orthopedic. We want to work with active people. The reality is that you can get a lot of job satisfaction from working in a variety of different settings. And I would just kind of keep an open mind and continue to learn as much as possible. I was thinking earlier, I want to say one thing kind of about like the clinical side of things too, because I'm not gonna lie, I was anticipating more of a advice for like students in the clinical piece.
Go for it.
Like one thing that I think is really important, and like Taylor, what she said about the CI that she's gonna have for her sniff really struck a chord with me. Be selfish and take something from every single one of your CIs. Like, it's not always about the setting that you're in. Sometimes it's about the way your CIs interact with patients, the way that they approach their daily jobs, the way that they can be lighthearted in times of emotional distress. And just like the beauty of the CI student relationship, it's such an intimate few weeks or few months, depending on the length. And like, it doesn't have to do all the time with the setting. Like, some of your best teachers, it didn't matter what subject that they taught, whether it was in high school, middle school, college, undergrad. Your best teachers were good teachers because of the way they communicated and the things you picked up from them. So like, that's what you want to do with your CIs, and like learn from them in that respect. And because students sometimes get so caught up in like, oh, I'm not in the setting that I want to work in, so whatever. Taylor's approaching the sniff thing with a good attitude of like, and maybe some things I told her along the way, like I took a lot from my personal inpatient because I had a good CI. One of my outpatients was the worst possible clinical that I had because my CI was so closed-minded and I couldn't have a conversation with him. Yeah. So like, it's your clinical experience is a lot about your CI, not the setting that you're in, and learn that way. So
yeah, that's awesome. That's an awesome point. I think me and Will both experienced that so far on our clinical placements, like taking a lot of really good points from settings that are not what we plan on going into.
Yeah, absolutely.
Cool, guys. So if you want to just leave your social media and let everyone know where they can find you, if they aren't already following you, which they should be. So
yeah, so my Instagram handle is Strength Coach Therapy. It's all one word, Strength Coach Therapy. And you can find me on Twitter and Facebook with that as well. My Twitter's my name, Teddy Willsey, Teddy, and then Willsey. I started going down that route. I was like, I don't need to spell my name.
At least you know how to spell it. It's good.
I screwed it up. I got awkward.
Oh, man.
Yeah. And then my Instagram is my name, Taylor.Eckel. I will spell that one, Eckel. You can't sound it out as well. And that's probably the best way to get in touch with me.
Awesome. Guys, we appreciate you guys taking the time to come on and talk with us. I think it'll give our followers a good perspective on, a student and a CI and kind of what they can do to optimize their clinical placements coming up. So we really appreciate it.
Thanks so much for having us. This was fun.
Yeah,
cool.
Thanks, guys.
All right. We'll talk to you guys later.
All right. Bye, guys.
See ya.
Bye.
That wraps up episode 25 of the PT Coffee Cast with Teddy and Taylor. We'd like to thank them for coming on the show and talking with us. We thought it would be an interesting dynamic to have a student as well as a clinical instructor on our podcast to kind of talk about their experience together. And I think Teddy and Taylor did a great job of sharing their experiences. And I think there's quite a bit of information that we can take away from this. I know myself and Will took a lot away from it as students, and I think that if there's any clinical instructors out there that were listening, that they could take some valuable information away from Teddy and how he approaches teaching his students when he has them on placement. So if you guys aren't following Teddy and Taylor, I highly suggest you guys go do so. They're putting out great content. We've been following them for quite some time now and continue to learn something from them every day. So guys, head over and give them a follow. If you want to follow us, you can follow us on Instagram, Twitter, and Facebook at the MVMT PTs. If you guys want to email us and get in contact with us, you can email us at themovementpts@gmail.com. And one last thing, guys, the Level Up initiative is something we've been part of for the last little bit, and we're excited to see that Zach has launched a Level Up initiative. So the website is live, his podcast is live, so head over to his website. We'll link that in the show notes. If you guys are a student and you want to be a mentee, you can apply for being part of the first wave of the mentee program. And if there's any mentors out there that are looking to give back to the students, you can also apply on the website, thelevelupinitiative.com. So guys, head over there. We're super pumped about that. I know Zach's been working really hard on it, and for it to finally come out for everyone to see, it's really exciting. So that's all we got for today, guys. Thanks for joining us, and we'll see you next time. Peace.